Good morning, everybody. So today we will learn plasma proteins and their functions. As we know, blood has two components. One is solid component and another is liquid. So when we collect blood with anticoagulant and allow it to centrifuge, the above supernatant is called plasma. When it is without anticoagulant and we allow it to stand for some time, blood gets clotted. It becomes jelly-like thing, and after a while that clot retracts, and due to the retraction a clear supernatant is separated out. Here in the beginning you will find that blood, it is just like that collected. It is collected like that. Okay. Now it will become jelly-like thing, followed by this portion will start contracting and express the liquid portion out of it, and this portion will become like that. This is a solid part. Okay. So that is called serum. Now difference is that in plasma as we are adding anticoagulant, coagulation factor is present because the coagulation part has not taken up in the plasma portion. So that portion, that molecules responsible for the coagulation will be here in the plasma. But in serum, we have allowed the coagulation to take place. So I should say proteins responsible for coagulation is utilized and clumped together in the this portion, this solid portion. So in the serum, the protein responsible for coagulation will be absent. This part you understood now? Because here it has an importance. When we try to separate or do some experiment for some disease, we may need plasma. For other disease, we may need serum. Okay. So plasma proteins, blood is mixed with an anticoagulant and centrifuged. The cell component like RBC, WBC, platelets, etc. precipitated, and the supernatant is called plasma. This part clear? The blood is withdrawn without any anticoagulant and allowed to clot. After 2 hours, liquid portion is separated from the clot called serum, which lacks coagulation factors including prothrombin and fibrinogen. So, whether it is plasma or serum, it contains lot of different proteins. Now, a lot of proteins are there. All the things we in this class or in this stage of our MBBS, we may not need. The important things we need are albumin, globulin, fibrinogen. We will discuss on have a discussion on that. All the plasma proteins are synthesized in the liver except immunoglobulins. They are synthesized in reticuloendothelial system and plasma cells. The different proteins present in the plasma are separated. Now, whatever technique, whatever test you need, you have to separate the protein, that protein part. Multiple proteins are there. One will interfere, others test. So, we have to separate the protein part, and there is a technique of separating the protein from the plasma. That is technically called fractionation of protein. So, different techniques are there. You have to know this salting out and salting in method, Cohen's fractionation, electrophoresis, the most modern technique of separating the proteins, ultracentrifugation. Sorting out method. By adding out the sorting out the major proteins in the plasma like albumin, globulin, fibrinogens are separated by using ammonium sulfate. If you go on adding ammonium sulfate to separate albumin, globulin and fibrinogen, what type of sample we will take? Which one? Which one? Serum or plasma? Serum or plasma? Anybody? We will separate out this, sorry. We will separate out this albumin, globulin, fibrinogen. Which part, which sample we will take? Plasma or serum? Pardon? Anyone please tell? No matter if you are wrong also. Yes, serum is not without the protein. Serum is with protein only. Okay, one is not there. Serum has consumed the fibrinogen. Okay, fibrin clots are there, so fibrinogen has been consumed. So we are going to estimate separate. Yes, we are going to separate albumin, globulin, fibrinogen. So sample will be your plasma. Okay, so if you go on adding ammonium sulfate bit by bit in 1/5 saturation of the solution, the fibrinogen will precipitate. In half saturation, globulin will precipitate, and in the full saturation, albumin will precipitate. So after that, we can separate it out and do our required test. Sodium sulfate is also can be used instead of ammonium sulfate. Cohen's fractionation. The scientist Cohen used varying concentration of ethanol. He used the concentration of ethanol. See, this thing you may get a number, short note carrying 3 numbers. So you don't have to write more than this. In your level, you have to write this much only. So ethanol separates plasma proteins in different concentration, and in fraction 1, in 4 fractions we get. In fraction 1, majority is fibrinogen. Then fraction 2 rich in gamma globulin. Fraction Third is contains alpha and beta globulins. Fraction 4 consists of predominantly albumin. Now, electrophoresis. It is the commonly used separation technique in clinical laboratory to separate plasma proteins, amino acid, enzymes, nucleic acid. So many molecules can be separated by electrophoresis. Electrophoresis refers to the movement of charged particle through an electrolyte in electrical field. So this is a glass slide. On that we pour agar gel. Agar gel we put. There is one term agar gel electrophoresis. Different types of electrophoresis. So we put agar gel. Now here one electrophoresis stand is there. You can keep the slide. One side there is phase, another side is neutral, anode and cathode. Okay. Now, in the agar gel, we make a line like that. We make a line. On that line, with the help of micropipette, we add serum. After that, we put the thing on, and this is kept in electrolyte medium that is called buffer. Okay, buffer. So we put it on and we keep for overnight. And after that, we see that from here some portions of protein has separated out. Like that, it gets separated. Albumin is having the smallest molecular weight among these 5 bands. So it travels faster and it accumulates here. Globulin comes thereafter in 2 parts, alpha 1, alpha 2, beta globin and gamma globin. These 4 portions are globulins. Okay. See, we have charged here start point. Albumin is traveled the farthest most, then alpha 1, alpha 2, beta, gamma. So these are separated like that. Okay. Now we let it dry. Then we do densitometry. The density, the depthness of the color is proportional to the concentration of the solute of interest. So in densitometry, we get a graph like that. See, the maximum amount is albumin. So we get a deflection of albumin like that, a large deflection. Then comes your alpha. Alpha has like that. alpha 2, beta, gamma. They say it is like that. This is albumin, this is alpha 1, this is alpha 2, this is alpha, beta, and this is gamma. Estimation is done by densitometry. Remember this one. Now, this is a electrophoretic pattern of normal serum. This is normal serum. Here albumin, alpha 1, alpha 2, alpha beta, gamma. See, color of the albumin is a bit deeper, so it will give bigger, larger deflection. Then it is a bit less, and these are gamma globulin fractions are less, so they will have less deflection. Now, here we have taken serum. That's why one band is not there. Here we have put plasma. In case of plasma, there a distinct band appears between gamma and beta. That is because of fibrinogen. That is because of fibrinogen. Now, significance of fibrinogen is that in case of a paraproteinemia, like multiple myeloma, we get a special type of protein, Band-Jones protein. You might have heard in your practical class, Band-Jones protein. That gives a band in the same case. So there may be confusion whether it is fibrinogen or M-band. M-band is for multiple myeloma. Now, because of that, I was telling what sample we are going to use. When we examine a case of, when we make a fractionation of protein by using electrophoresis, using sample from multiple myeloma, then we will use serum, so that fibrinogen portion is not there, and this will not interfere our report. Okay. So both these are normal. Only the difference is sample we have taken different type of sample. Now, you may have electrophoresis, you will get short nose, or you may get long questions. And two portions will be there. What is electrophoresis? What are the normal finding? And what discuss one or two abnormal finding. So much you don't have to write much. Give picture and this one, just 2-3 points. So here normal serum pattern. Here normal serum pattern, and in multiple myeloma, what I was telling, this is fibrinogen, place of fibrinogen. Here we get M-band. So there will be M-band in case of multiple myeloma between beta and gamma region. Understood now? Normal electrophoresis, and this is chronic infection. In infection, there will be less formation of albumin. So the band for albumin has become less wider. Okay. In chronic infection, there will be increase of globulin synthesis. However, there is albumin goes down, globulin try to fill up the space, so globulin fraction will come up. So in chronic infection, alpha 1 and alpha 2 blend becomes a bit increased. Okay, and albumin may be reduced. Nephrotic syndrome. Nephrotic syndrome is a disease where a large amount of protein is excreted out through urine, goes out from the body through urine, about 3 grams per day. So naturally, this much amount of protein, if it goes down, goes away from the body, there will be hypoproteinemia. Hypoproteinemia. Whatever related to blood is mia. Okay? When it is hemoglobin is less, anemia. When it is albumin is less, hypoalbuminemia. Okay? So there will be hypoalbuminemia. So albumin part has become less. I told you there will be increase in globulin fraction where there is a hypoalbuminemia. Then you will get a alpha 2 band, prominent alpha 2 band. But in one condition, in case of malnutrition or protein energy malnutrition, you will get both these albumin and globulin fraction less. Now this is cirrhosis of liver. Cirrhosis of liver, I told you all the proteins are formed except immunoglobulin in the liver. So in cirrhosis of liver, liver function is severely distorted, it has come down. So there will be a less amount of protein formation, synthesis. So albumin has come down. Cirrhosis of liver, decreased albumin band will be there. Functions of plasma protein. Helps in maintaining internal colloidal osmotic pressure. Visible or not? From back? Can you see? Okay, this is a capillary. Capillary, this is the venous end, that is the arterial end. Here, blood pressure remains 30. What is the normal blood pressure? It is 120 by 80. But when it comes to the capillary region, it goes down. The effective pressure is 30 millimeter of mercury. Hydrostatic pressure 8 millimeter of mercury. Oncotic pressure 15 millimeter mercury. It is in the intravenous, inside lumen. Tissue oncotic pressure 10. In the venous end, blood pressure remains 22. So in the arterial side, this blood pressure, it will try to push out fluid in the tissue part. Okay. Now again, this hydrostatic pressure, it will try to push the fluid inside the capillary. So there is a difference of 22 millimeter. So 22 millimeter. Here, hydrostatic pressure is 25 and tissue oncotic pressure is 10. So these two will try to push the fluid inside the lumen. So here is a difference of 15. Now this will try to push the fluid inside and this will try to push the fluid outside. So there is a difference. The one which is trying to push the fluid outside is 22 and one which is trying to push the fluid inside is 15. So there is an effective filtration pressure of 7 millimeter. Because of that, fluid will go outside from the capillary. Now, just opposite here, the fluid here in the venous end will go inside the capillary. So, by this way, they are maintaining a oncotic pressure inside the vessel. Transport of various substances in the blood then plays important role in defense mechanism. Immunoglobulins, they are responsible for defense mechanism of the body. Then plays important role in inflammatory reaction, plays important role in buffering action. That is already explained in the last class. As it is ampholyte, it can receive proton or it can donate proton. So by this way, it has a buffering action in the blood. Helps in maintaining viscosity of blood. All the proteins they produce viscous in solution. Maximum is by the fibrinogen. Plays important role in blood coagulation, that you know. Nutritive function. It is a class 1 protein. Whenever the body requires protein, it is taken up. Polypeptide chains are taken up and utilized there. Normal value, total serum protein concentration 6 to 8 gram per deciliter. Albumin remains 3.5 to 5 gram per deciliter. Globulin 2.5 to 3.5 gram per deciliter. Fibrinogen 200 to 400 milligram per deciliter. And AZ ratio, it is from 1.2 to 1.5 is to 1. Now, individual protein, albumin, here is nothing to understand, memorize. The major protein, plasma protein, it is the major plasma protein. Simple protein synthesized in the liver having molecular weight of 69,000. It has one polypeptide, single polypeptide chain with 585 amino acids having 17 interchain disulfide bond. It is precipitated by the full saturation of ammonium sulfate. It is the first state moving by BCG method, bromocresol green method. This is a dye. Using this dye, the concentration of albumin is measured. Have you done estimation of albumin in your biochemistry? Not yet, na? Okay, you will do. Functions, all you know. Therapeutic use. In case of hypovolemia, where there is a blood loss or there is a fluid loss, it is used as therapeutic agent because albumin is infused. Albumin remains longer time inside the vessel and maintains the intravascular pressure. Another thing is, in case of cirrhosis of liver, in case of nephrotic syndrome, there is a extensive loss of albumin or markedly diminished formation of albumin. So we infuse albumin as a drug, as a modality of treatment. Okay? Now, these are the therapeutic uses. Globulins, major protein having molecular weight 30,000 to 1,30,000, 13 lakhs. These globulins are precipitated by half saturation of ammonium sulfate. Electrophoresis, these globulins are separated alpha 1, alpha 2, beta 1, beta 2 and gamma globulins. Alpha and beta globulins are synthesized in the liver, whereas gamma globulins synthesized in the RA system, reticuloendothelial cell system. Then alpha 1 globulin, alpha 1 acid glycoprotein, alpha fetoprotein, alpha 1 antitrypsin, retinol binding protein, HDL, alpha 2 globulin, ceruloplasmin, hepatoglobin, and alpha 2 macroglobin. Beta globulins include transferrin, hemopexin, beta 2 macroglobulins, CRP, C-reactive protein, and LDL. Gamma globulins, different immunoglobulins. Now here, some of the critically important alpha 1 globulins, they are alpha 1 acid glycoprotein synthesized in the liver. It is an acute phase protein, means in acute inflammation or chronic inflammation, it will increase. Acute and chronic inflammatory disease and its concentration is decreased in liver disease, nephrotic syndrome, sorry, and malnutrition. Alpha fetoprotein, very important. This is a tumor marker. Act as tumor marker for hepatocellular carcinoma. Estimation of alpha 1 fetoprotein in amniotic fluid and plasma is helpful in diagnosis of neural tube defect and Down syndrome. Down syndrome is a genetic disorder, and neural tube defect. You have seen some babies used to have some tumor-like thing here since their birth. You might have seen, but it is due to neural tube defect. Alpha 1 antitrypsin synthesized in hepatocytes. It has a single polypeptide chain with 394 amino acids. It is also called protease inhibitor, serine protease inhibitor, which inhibits activity of the enzyme serine protease. Deficiency of alpha antitrypsin causes emphysema of the lung, and also its concentration is decreased in liver disease. What happened? There are two diseases. One is emphysema. Emphysema is nothing but the swelling of the lung. Swelling of the lung, patient used to have difficulty in breathing. How it happens? In case of lung infection, say pneumonia, macrophages, they release elastase. And lung has elastic fibers in its alveolar wall. So, when elastase is released, elastase digests the elastin and hampers the lung. In normal case, this elastase is inhibited by alpha 1 antitrypsin. Inhibition of elastase. So, it cannot hamper, it cannot harm lungs. That's why when it is present, lung is safe. When it is not there, lung is in danger due to the action of elastage. Okay, this is the mechanism of emphysema, developing emphysema. What happens? The alveolus are there. Alveolus that you will learn afterwards. It is like that, no? Alveoli. So what happens? Here elastage is there. Elastins are there, fibrous tissue. Then here elastage, it functions and it dissolves the elastic tissue. So the whole thing becomes like that. Okay. Now its surface for gaseous transfusion, gas exchange becomes less. See, here it is having like that, then like that. Okay. Now so many bands are there, means there is a widespread surface area. So surface area comes decrease. That's why they say lungs become swelling up. There is swelling up of lungs. Okay. So it doesn't happen when there is a alpha 1 antitrypsin. Now, due to what happens? Mutation of the gene responsible for production of the alpha 1 antitrypsin, the defective protein is produced. That alpha 1 antitrypsin does not act. It accumulates in the liver and it causes harm to the kidney. It accumulates in the kidney tissue, renal tissue. Now, in smokers, what happened? There is a methionine moiety in the 358 position of the alpha 1 antitrypsin. Let me see the exact position. 358 position, there is a methionine residue. What happens? When they smoke, the oxidizing agent in the smoke, they oxidize this methionine, sulfidyl group of methionine into methionine sulfoxide. Because of its formation of methionine sulfoxide, it cannot bind to the elastase. So people who are smoking, they have usually more incidence of emphysema. This one short note. Alpha 2 globulin, ceruloplasmin. It is a glycoprotein, copper containing enzyme synthesized in the liver and important will go a bit fast. Plasma antioxidant. It has peroxidase activity and incorporation of iron. It has peroxidase activity and it converts ferrous ion into ferric ion and thereby help in incorporation of iron into transferring. Normal serum ceruloplasmin concentration is 25 to 50 mg per deciliter. When it comes below 20 mg per deciliter, the person develops Wilson's disease. Wilson's disease, this ceruloplasmin helps to throw out the copper from the body. So, when ceruloplasmin becomes less, the amount required to expel, amount of copper which is needed to be expelled from the body is not there. So, copper gets accumulated in the liver, in the brain. In the liver, it becomes accumulated. In the brain, there is basal ganglia. So, it accumulates there, causing hepatolenticular degeneration. Then they accumulate around the cornea. That is called Kaiser flexor ring. Kaiser flexor ring. So this is the problem that develop in case of ceruloplasmin concentration goes down. Haptoglobin glycoprotein synthesized in the liver, it binds with plasma free hemoglobin and thereby prevent the excretion of hemoglobin in urine. It acts as an acute phase protein. Its concentration is increased in all inflammatory conditions. Beta globin, major beta globin having clinical importance, transferring hemotoxin, CRP, LDL, CRP, these are transferring, very important. Transferrin is a glycoprotein, non-heme iron containing protein, molecular weight 70,000. It is the transport form of iron synthesized in the liver. It is an acute negative phase protein. Normal serum transferrin concentration ranges from 200 to 300 milligram per deciliter. Negative phase means when there is a normal iron, when there is an increased iron concentration in the body, it goes down. That is the negative. Beta macroglobulin, it has low molecular weight peptide consisting of 100 amino acids present in urine less than 0.01 milligram per deciliter, and its normal serum concentration is about 2.5 milligram per deciliter. It is increased in multiple myeloma, lymphoid leukemia, lymphoma, and also in renal disease. C-reactive protein, very important. C-reactive protein, we used to estimate it in day-to-day activity when a baby, when an adult, when after surgery, like this, to see the progress of the healing of the wound. So, if there is infection, it will go up. Baby, if he is having pneumonia, it will go up. So, after giving the treatment, if it goes down, that means patient is responding. C-reactive protein, it is called because it reacts with the capsular protein of the pneumococci. Sorry. Belongs to beta-2 globulin group and consists of 5 polypeptide subunit and is a disc-shaped polymer having molecular weight of 115 to 140 kilodalton. This is synthesized in the liver, stimulates complement activity and macrophage phagocytosis. It is acute phase protein, concentration increase in inflammatory condition. Surgery is also having inflammatory condition. Surgery is injury. We are cutting for the betterment of the patient, but we are injuring the tissue. So there will be inflammation. So that inflammation will cause rise in the C-reactive protein. In case hs-CRP level in blood indicates the risk of coronary artery disease. Recent as blood test. Fibrinogen, glycoprotein synthesized in the liver, molecular weight 3,50,000, precipitated by 1/5 saturation of the ammonium sulfate. Normal range is 200 to 400. It is also got clotting factor 1, involved in coagulation of the blood and helps in maintaining viscosity of blood. Now, in case of coagulation, the fibrin is acted upon by thrombin, and fibrinogen will be converted into fibrin. Multiple fibrin molecules, they bind together to form a fibrin mesh. And that will stop the bleeding. Clinically important plasma proteins. Clinical importance of plasma proteins: hypoproteinemia, serum total protein concentration below the normal range is called hypoproteinemia. Also called hypoalbuminemia because Hypoproteinemia, mainly albumin concentration goes down. Hypoproteinemia causes are hemodilution, decreased synthesis of albumin like chronic liver disease, malnutrition, malabsorption syndrome, malnutrition when there is there is no intake of quality food, balanced diet lacking of amino acids, and malabsorption syndrome means the person is taking food but he cannot digest it, so required amino acids and all required food materials are not absorbed properly. Sorry. Due to increased excretion of albumin in nephrotic syndrome, Burns nephrotic syndrome, Burns multiple myeloma, protein losing enteropathy. In case of cirrhosis of liver, protein energy malnutrition, nephrotic syndrome, multiple myeloma, age ratio is altered because these conditions albumin concentration is very much decreased and globulin remains normal or slightly increased. Edema occurs when total serum protein concentration goes below 5 gram per deciliter and albumin concentration below 2 grams. Hyperproteinemia, increased total serum protein concentration more than normal is called hyperproteinemia. Sorry. This mainly due to increased serum globulin concentration, hence called hypergammaglobulinemia. Hemoconcentration, SLE, systemic lupus erythematosus, tuberculosis, chronic infection, multiple myeloma, some of the important cause of hypergammaglobulinemia. Transport proteins in the blood. Blood is watery medium, so lipid soluble substance will not easily dissolve in the blood. Such molecules are carried in the blood by specific carrier protein called as transport protein in the blood. Examples: albumin, they carry these molecules. Pre-albumin, thyroxine, retinol, and steroid hormone. Thyroid binding protein, hemopoietin for free hemoglobin, hepatoglobin for hemoglobin, transferrin carries of iron, ceruloplasmin, copper, LDL, cholesterol, triglyceride, HDL, cholesterol. HDL is called good cholesterol because it contains polyunsaturated fatty acid. Acute phase protein, short note. The level of certain plasma proteins in the blood may increase 50 to 1,000 folds of their normal values in various inflammatory conditions. Such proteins are called acute phase protein. Some important acute phase proteins are C-reactive proteins, ceruloplasmin, alpha-1 antitrypsin, alpha-1 acid glycoproteins, haptoglobin, alpha-2 macroglobulins, and fibrinogen. Acute negative phase proteins, level of certain plasma proteins in the blood may decrease below their normal value in various inflammatory conditions. Such as proteins are also called acute negative phase protein. Albumin, pre-albumin, retinal binding protein, transferrin. More the inflammation is there, the value will decrease. Bad Jones protein or multiple myeloma. Short note. Multiple myeloma, it is a plasma cell cancer. About 1% of the all cancers are multiple myelomas. Female are affected more. Usual age group is 40 to 60 years. There is increased concentration of immunoglobulin, usually IgG and IgA light chains are produced in excess than heavy chains. There are two chains in these are short chains, usually kappa and lambda. In one type of immunoglobulin, one type of short chain will be there, either kappa variety or lambda variety. In case of multiple myeloma, there is huge production of these short chains, but required amount of heavy chain is not produced. So these kappa chain, excess kappa chain and lambda chains, they are excreted in the urine. This is the Ban-Jones protein. Because of the low molecular weight, they passes through glomerular membrane and appears in urine. Sorry. Multiple myeloma is a malignant plasma cell tumor of bone characterized by paraproteinemia, lytic bone lesion, anemia, spontaneous pathological fracture of the bone, X-ray show punched out osteolytic lesion. When you see X-ray, there are two layers of skull bone. You will find there is lytic light lesion, absence of this continuity of the skull bone. So there will be lytic lesion in the skull bone, may be there, long bone it may be there. So where there is a lysis, there is weakness of the bone and bone gets spontaneously fractured. That's why it is called spontaneous pathological fracture of bone. There may be hypercalcemia, hypercalciuria, hypergammaglobulinemia. There is an increased beta-2 macroglobulin in the blood and there is a reversal of AZ ratio. Diagnosis of multiple myeloma is done by heat test or Bradshaw test, electrophoresis. Heat test, you know, when the urine sample is heated in a slight acidic medium, the coagulation appears between 40 to 50 degree centigrade. Again, on going on heating, it disappears. Again, you pull it down, it appears in 70 degree. Again, it disappears like that. Bradshaw test. This is concentrated hydrochloric acid pour urine sample from the side gradually. So there will be so urine sample here. There will be a white band ring indicating presence of protein, Ben-Jones protein. Now electrophoresis we have seen. So by this technique, the multiple myeloma is diagnosed. Here some of the points are there. Try to prepare this and remember. You will get questions from this one, definitely. Some of the things I'll let you know, just remember this one. I see. Glycine. Abundant amino acid. Alanine. Hydroxyl containing amino acid, not soluble in water. Tyrosine. Most basic amino acid, arginine. Least water soluble. Glycine. Difference is hydroxyl containing amino acid. We know hydroxyl containing amino acids are usually water soluble, but tyrosine is not. Glycine supposed to be water soluble, but it is not. It's a maximum buffering capacity. Histidine. Most ketogenic leucine, most glucosenic alanine that you will get in the when we go for metabolism. Then okay, this must. So with this we are completing plasma proteins.